So my name's Michelle Foster. I'm a clinical scientist in audiology and I work at Leeds Teaching Hospital. I've been there about a year. Formerly before that I was at Sheffield Children's Hospital for about 13 years. So audiology is a fascinating discipline. We diagnose hearing losses from children right through to adults. We also diagnose vestibular problems, we look after people with tinnitus, and we really do provide the whole pathway. We look after our own patients, and really in paediatrics, which is my specialism, you build a massive relationship with that family because you see their child from being 0 all the way through to being an adult. So the relationship you build with the family and the patient's amazing. Well, I started out as a biochemist, and during my PhD, which was diabetes in pregnancy, I really liked the patient contact, and there was a trainee post within audiology. And because you can look after your own patients, like I said before, it really appealed to me. So I applied, and the rest is history. I got the post and they trained me to be a clinical scientist in audiology, and I've never looked back. I really love it. So it's massive. At the moment you can come in as an apprentice, so straight from school. We've got an apprenticeship route which we've worked really hard within the Yorkshire and Humber region to set up. You can come in at a degree entry level, or you can come in at the MSc level. So really whichever level you want, there's a fulfilling career. And depending whether you like children or the adult side or diagnosing vestibular problems, everything's very interesting and very dynamic. So more recently within Leeds, I've been looking at how we can help the learning disability adults access our service. So at the moment we're looking at whether we're going to screen within the community setting, and then for those who need our services, how we can facilitate helping them feel at home. We're also looking at perhaps starting a dementia screening service, because obviously there's a massive link between dementia and hearing loss, and if we can address the hearing loss, hopefully we can slow down the progression of dementia. So we're just looking at different models and different ways of accessing that. So that's really exciting, because I'm meeting all sorts of community workers, commissioners, to look at how we can develop that within Leeds. One of the things that I'm very passionate and is a big barrier within audiology is people's perception of audiology. So a lot of adults won't come to clinic. They quite often ignore a hearing loss for 10 years before they'll access our help. And yet, really, hearing's about communication. Hearing's about accessing your world around you. And we know that with a hearing loss, you can get isolated very quickly. So my passion would be to help adults to remove that stigma really from society, and help adults particularly access our services a lot quicker, and to help them lead the life that they can connected to their families. And obviously funding's always an issue within the NHS, but I think the more you network and the more connected you are, the greater the opportunities. And it's amazing as you step out of your comfort zone, which has been one of my biggest barriers, just stepping out and taking that plunge, then there are opportunities to be had. I think being in a new place, I've had to step out my comfort zone, so just connecting and meeting new people has just been amazing. And also within our trust, we've got lead healthcare scientists, so we set up a forum where we're all working together to try and look at how we can help each other, support each other. And particularly, for example, life sciences have got a great accreditation program already, and how they can help us in the physiological sciences, but equally how we can help them develop some of their areas as well. So I'm loving that, although I didn't like it at first, but being connected with other people. Plan your career, decide where you're going, and get a mentor to help you. So one of the greatest things I've had the privilege of being involved in is the CSO Wise Award. So they get you to look at how much tarmac you've still got on your road. So how much of your career have you still got left and where do you want to be? Because it doesn't happen necessarily, you need to try and make it happen, but there's people out there who are willing to help you along the way. And I've had 2 fantastic mentors through that. I've had an NHS one and an industry mentor, and they've both been amazing. And they just prod you and poke you just at the right time to get you to think outside the box. So if you can, get yourself connected to other people who've already arrived and get yourself a mentor. So Healthcare Science Week, we're doing it as a trust. So I've sent an email out asking people to get involved. So we're going to do stalls throughout the whole week in both of our sites at Leeds Teaching Hospital with different stalls showcasing what we do and our value that we add to patients. It was very successful last year, so we're going to make it bigger and better.